am not Dr. Sandy today. I am Natalie. I am on the marketing team at FMCA. You may have seen me. I was in a webinar last December. I was being coached by Jess, one of our wonderful health coaches, going over my function health results. So I'm back on the webinar train. I'm very excited about the topic that we will be covering today. It's something that I am super passionate about as a health and wellness enthusiast. And today we have with us Dr. Aly Cohen. And she is a board-certified rheumatologist and integrative medicine specialist, as well as a leading expert in environmental health. And she is the founder of The Smart Human. She also has a book coming out soon that she will share with us. She spends her time educating the public on how everyday toxins impact our health, and we are thrilled to have her with us today. She was also on Health Coach Talk just a couple weeks ago, so you may have seen her episode then. But welcome, Dr. Cohen. Can you start by telling us a little bit of your background, how you got involved in this area of medicine?
Thank you for having me. It's always a pleasure to be asked to do anything. I have two teenagers who asked me to do nothing, so this is very flattering. I'll try to keep my history brief because I would rather get into some of the really nitty-gritty and stuff that you guys can use. But I'll just tell you how I got into this, because I would not be doing this if it was not for my dog, believe it or not, my golden retriever, 15 years ago, getting sick. And it's a true story. So I was a young mom with two young kids. I think they were ages 3 and 1 or 2.5 and 6 months. And my dog, my firstborn, was 4.5 years of age, golden retriever, and he just got sick and we didn't know why. We thought he swallowed a sock. And when we went to several vets, they didn't know what he had. And then finally we discovered he had autoimmune hepatitis, which is an autoimmune disease where his body's immune system gets kind of triggered and turns itself on itself. And so his liver was the size of a golf ball, essentially, when we had him diagnosed, which is rare in dogs and rare, particularly in golden. So it was a really surprising and actually heart-wrenching moment, because here I was just out of fellowship, practicing young mom, and I'm an autoimmune disease specialist as a rheumatologist, and I didn't even understand how this could happen. And of course, beyond him, I was worried about my own family. Like, we had just moved to New Jersey. We had, we always had spraying going on, had no clue that there was any problem with that. And so we were just kind of naive. But when I was reviewing what he was exposed to out of just sheer heartbreak and concern and curiosity, I was looking at his water, I was looking at his food, I was thinking about what we put on his back, between his shoulder blades for his flea and tick collar stuff that I might not wash off if I didn't have time, or, it was just one of those things. His red toy, he had a plastic toy in his mouth round the clock for 4.5 years of his life. So I was essentially doing, now that I look back, it kind of dawned on me that I was doing an environmental health survey, which I never did with humans, but I did with him. And fast forward, as I began to start to question and learn, and so shocked I didn't learn this in medical school, so shocked that there was so much of an abundance of medical literature at that point, 15 years ago, to show that environmental chemicals are not regulated, many of them, most of them, that, they have no manufacturing oversight, no regulated testing for toxicity, safety before going into our products, very limited in food system, hardly anything in the water system. It was like finding out like Santa doesn't exist and I'm Jewish, right? So I was just like, what? This is crazy. And, but I didn't speak out on it until, I spent 15 years learning. I reached out to Environmental Working Group, who had the most to say online. I reached out to lead authors of all the journals that I was reading on BPA, particularly Fred von Saal, who's like the forefather of BPA research, and then became a co-author for two textbooks with him. That's a fun story. And essentially, I just organically started picking up information, sharing it, and then being pulled into another opportunity. So here we are 15 years later, 2 Oxford books. One's a textbook with Fred, who pulled in all his colleagues. And then now this new book, which has now gotten to a point where I'm implementing all of my rheumatology training because of this epidemic of autoimmune and immune disorders that we're now seeing, plus integrative medicine training from Dr. Weil. And then, and his colleagues, of course, for training on that. And then this environmental health piece. So it all just came together And here we are, still battling the battle. But I want people to know how to do this for themselves. And I'm sure someone's going to say to me, well, what do you think about all the, RFK stuff and changes in the market? I applaud anything that's in this lane, right? Anything that's in the food chemical, environmental chemical, cleaning, that lane I support 1,000%. But it doesn't matter if it's him or anyone else who's part of the administration. I've been through multiple presidents in 15 years. I've been through multiple H. My whole mantra, and always has been, we got to do this for ourselves, because even taking one red chemical, dye number 3, or 6 PFAS that were on the table last fall when Biden was in, for the water system, which now has been removed, like waiting for all these little teeny out of 95,000 chemicals, whatever, is never going to be fast enough or move quickly enough to really coincide with what we're seeing in terms of health related issues. So there is a time factor in our lifetime to manage this for ourselves and to really do what we can to reduce chemicals, but also reduce risk and kind of change the destiny of our health. And I mean that 100%. So that's it. Let's move on. I don't want to belabor this.
Well, that is such a great story. It's honestly the way that a lot of people come to this field, and a lot of our health coaches want to be health coaches because of a personal story, just like your story with your dog. And so it's really out of passion and wanting to create a healthier, environment just for themselves and for others, and educate on that. So with that said, you talked about a few different chemicals when you were going through that, and the quote toxins that we're exposed to. As somebody who I try to make healthy decisions and better choices within my home about the products that we're using. So with that said, that's a area that health coaches rarely cater to when helping educate and inform clients about products. So can you explain a little bit more about how the products that we use in our homes and on our bodies, how they might affect our health?
Yeah, sure. So it's a big topic. So let's start with the fact that we have, an estimated, this can be higher or lower, but most likely higher. 95,000 is kind of a working number, just to give people the breadth of this problem of how many chemicals that we actually come in, are in the products that we love, whether it's food packaging, food itself, processed, ultra processed, and even minimally processed foods, food washes, pesticides, cleaning products, products that are sprayed on textiles, to make them stain guarded, food wrappers, air fresheners, clean, so we have them everywhere. The way they get chunked out, and I've had to manage this for a lot of years, trying to figure out how's the best way to explain this big problem. The way they get chunked out is, chemicals can be created for their function. So like I said, stain guard chemicals, nonstick chemicals, waterproof chemicals, by their definition of what they do. They can also be chunked out and divided up by what they harm. So neurotoxins, liver toxins. So there's lots of ways to take this big group of chemicals and sort of, section them out into ways that will serve your purpose, what you're trying to explain. I like to say that the purposeful ones, the ones that are made by function, resonate, as people who are coaches, resonate best with people who you're talking to, your clientele, because then they can tangibly remember, like I did spray, believe it or not, I did. My journey has been a long one. I used to spray my couch with stain guard because I had 2 young kids and dogs, and a dog and a cat and all that. So when I think chemicals now, I think, oh, maybe I shouldn't have done that because that was a function that I was looking for. But guess what? It might not be as healthy as I want it to be. And so I think that resonates with everyday people, as opposed to saying, oh, don't eat phthalates or don't eat BPA or watch out for the heavy metals. You're like, all right, well, where are they? So I think that's very helpful with my patients as well as maybe your clients. But we have specific groups of chemicals that we can also wrap our head around. So for instance, perfume. So if you think about perfume and fragrance, we know that there's a lot of chemicals in there, the proprietary. There's no required testing for any of those chemicals before they go into products in the US. For personal care, fragrance, particularly in laundry detergent. I mean, fragrance is in everything, right? It's such a sellable concept that they spray perfume outside of Abercrombie and Finch, and they spray in, everywhere you go, scent is a component. It's actually a problem in California. It's under the American Disabilities Act that you can't actually wear perfume in the workplace because you can offend people and make them sick. So it's a very interesting topic, but needless to say, what makes fragrance, for instance, last longer? The stink, the smell, the scent, whatever. It's phthalates are a group of chemicals. There are thousands of them. And phthalates are a class of chemicals that make plastics. So they're part of food packaging. But they're also, a lot of these things have multiple functions. They also tend to keep fragrance lasting longer, which is how it makes it more valuable, right? And phthalates have been associated, and we now have so much data, robust data around the world. Number one, they can contribute to male genitalia issues for birth. So reduce what's called anogenital distance. And so they have a play with pregnant women who are exposed in terms of crossing the placenta into a fetus. Phthalates have been associated with learning disabilities and brain function, brain development, brain dimorphism into male, female. So this in utero exposure is really particularly important. And we want to coach females even before they get pregnant that this may be a problem, so we can get ahead of the problem. And where they're found is, one way is fragrances. But they can also be linked to immune system dysfunction, which is what I focus in on this book, not just hormone changes and immune system changes as well, and how that can play out into upregulating or downregulating the immune system. They can affect a variety of systems in the human body, not just endocrine and immune, but also neuroendocrine, which is a combination of many of those components. So phthalates are something that if you know where to find them, which, say fragrance or perfume on a bottle, if you see that, again, they don't have to disclose, but let's just say if they do, you can look for things that don't have fragrance, don't have phthalates, or if you want perfume, I teach people in the book how to choose those products from very reputable resources. And I give a bunch of them. So Environmental Working Group is one of them. Their app is Healthy Living, Clearia, Yucca, Think Dirty, a bunch of them in the book. So that's one set of chemicals that's chunked. There's other ones like, BPA, which we've heard of being taken out of plastic baby bottles in 2012. And the bisphenols. So BPA is just one of many bisphenols as a group. There's BPA, BPS, BPSIP. There's like thousands of them. BPA was the only one that was removed. It had enough data and evidence that showed that it affected hormone regulation in babies. Well, actually animals, this was 2012, but actually in even human studies, but it was only taken out of one component in our market, which is absurd because it lines the interior of every canned food in the US because it's an epoxy resin, it's epoxy plastic resin that's in the interior. So even if it's an organic can of food, it actually likely has BPA because no one wants to reformulate that. If it says BPA free for anything, you can be assured it's most likely a regrettable substitution, as it's called. So BPS now has been shown to be just as harmful, if not worse, than the effects on the human body and immune system as BPA. So, the idea is to figure out, in my opinion, where people walk through their lives, find out, we have a 50-question survey in the book, which is super reasonable, nothing over the top. And you get to do a point system so you know where you're starting. And so I created the 4A's, and that's the first part of the 4A's. The first is assess. The second A is avoid or swap, which means avoid where you can. You don't need 20 cleaners in the kitchen. We don't need an oven cleaner, sink cleaner, window cleaner, sink. It's incredible what we've been marketed to. So it's assess is the first A. Second is avoid. The third is add. We can take all the chemicals in the world away and not even know which ones, but let's just say we try to get rid of a lot of them. We need to add in important things for human health that have been part of evolution and anthropology at the cellular level since, for millions of years that we're getting away from. So we need to add nutrition. We need to add, we're all deficient, believe it or not. A lot of us are deficient, not just in one or two, but in lots of different micronutrients. So we add in those, it helps offset some of the even, the methylation and histone and sort of epigenomic changes of our genes from these chemicals. But it also gives us the ability to fight off, harm from these chemicals. And And then you add in sweat, you add in all these supportive detoxification process that anyone can employ. It's not about money, it's about knowledge. And then the last A out of the four, and I can go, the ad includes more things. It's stress reduction, it's sweating, it's appropriate sleep that helps reduce chemicals from the lymphatic system in our cerebrospinal fluid. And then the last A is allow. And from a coaching perspective, I think this might resonate with you guys the most, because this is how it resonated with me, is that, look, I color my hair. My kids have lacrosse practice on really toxic turf 6 days a week, and I have to be there for a lot of it. The idea is that you can't control everything. You're not going to take your kids out of lacrosse because they're toxic exposed. You're going to figure out how to work around that. You're going to make them shower and use, soap and water as a mandatory requirement whenever they're done anything on those fields, because that is a petroleum based exposure from those tires being chopped up and a bunch of other things on turf. So it's, how do we work around the world we created without freaking out? And so the allow is life, it's travel, it's, having to grab water bottles, God forbid, or how do we maneuver with making better choices, but not perfection? I'm a realist, not a purist. So that's kind of how I teach through the book. And that's how people maybe can jump on easier without being afraid of the topic.
That's so helpful, and it's actionable because, it's so overwhelming to hear all these terms. We consume so many products in our daily life. It becomes overwhelming. And probably a lot of people who aren't naturally just into the wellness space, they just get overwhelmed and they decide to do nothing. And it doesn't need to be all or nothing. So this is where I think health coach can come in and can help guide and inform and educate clients how to make better decisions and to use the tools. We don't need to overhaul everything.
Right.
The thing that I do personally is, when I have a product that I realize and I become educated that it might not be the best decision, because I didn't know prior to this, right? A lot of us, we didn't know. We're trying our best. We don't know that the perfumes and everything are toxic. So when it runs out, then maybe go to the EWG, the Skin Deep. That's what I often use. Double check what could be a better decision to then add into my life. So it's not overhauling it, but it's making it actionable. And so I think that those 4 A's is such a great way that health coaches could help to guide clients, because it's a journey and we don't have control over everything, right?
Sure. And I even have a 21-day plan, and the way the 21-day plan, and it's not going to make you toxin free in 21 days. That's not realistic. It's really jumpstarting the process and the awareness. And it's broken up in the 4 A's for the 21 days. So what I've encouraged people and my own patients to do is, let's do the 21-day plan together. Like, let's think of some of the top things that we can start to think about. And by the way, that plays into how we feel. I have patients, stories in this, which are really emblematic of the patients that come through here. Chronic fatigue. Yeah, you can certainly think about thyroid and vitamin D and all these other components that make us tired. Sleep apnea, restless leg. I mean, I can list 20, but you want to also address things that chemicals can do, from just, wearing our immune system down and how that works, because it's just one piece that you can have control over if you guys work together. And so it's just been really an interesting study on how people take this information in pieces, in nuggets. And that's when it sticks. It's not a diet. It's more of like, how do you incorporate this into your lifestyle? And a lot of times people don't go backwards. They get into it, they start changing, and then they really just keep moving. And you can almost gamify it. I kind of challenge patients and we have fun with it. We look up our products together. I just whip out my phone. It's more fun when you're connecting with a patient and you're actually looking up your lipsticks. I have a couple in mind that I can go to right away. Like, here's my lip balm or here's my shampoo. And if you just show them your products real quick, they'll be able to do this later at home with their products. And so it's kind of like this really cute, fun way to do it if people are interested.
Yeah, totally. So we talked a lot about household products and BPAs, things like that. I'd love to go more into the topic of drinking water. That's something that I think there's a lot of questioning around. Can you talk a little bit more about what regulations are on drinking water in the United States, and how should we filter our water, a little bit down that topic?
Yeah. And so I'll just start by saying, after doing all this for 15 years and having so many different areas of concern, whether it's food, whether it's air quality, whether it's cosmetics, personal care, feminine care, even, the thing that has, no, well, I guess pun intended, has risen to the top has been drinking water for me, because what I've realized is that so little attention is paid to this topic. And yet, it's like one of the most vital components that we put into our body every day, can't live without, makes up 85-90% of our bodies. And then we rely on clean water to detox. So instead of, putting in clean water to clear out chemicals we can or can't necessarily control indirectly or what have you, we're putting in water that's actually pretty dirty. It's not third world country dirty, but it's dirty enough to give us real health issues. And I think if people understand some very simple facts about water, meaning that once you find out that, drinking water is controlled through, tap water, municipal tap water is controlled by 160,000 wastewater treatment plants across the United States, that 85% of the US population actually is serviced by this kind of this water from wastewater treatment plants. The other 15% of the US population manages wells, either their own well in their home, underneath their home, or their township, much more rural areas. And the Safe Drinking Water Act of 1974 is what applies to our current water system for these wastewater treatment plants. So we're talking 50 years later, we are now managing, we have thousands more chemicals, 1,000 more add to our system every year, by the way. 15 polymers are, patented every week. I mean, so there's an unending influx of synthetic chemicals that are being added to all of our products, and they make their way into the water system through lakes, through streams, through sewage, through aquifers, through rainwater. All of that circles back to the wastewater treatment plants that serve our drinking water, if you can believe that. And so, when we learn these things like what, and you find out that an old law is still working, and it only covers, by the way, 91 chemicals since 1974. 91 chemicals hasn't changed. So the idea that all this water is dirty goes through it, and right out the other side, it gets added to with chlorine, fluoride, and detergents that have to be, well, not necessarily fluoride has to be added, but a lot has to be added in order to have no public health crisis, with infection, of course. But then it comes right out the other side, travels 20, 30 miles, goes through PVC piping, which adds, issues of health, toxicity, adds, lead piping that you may not control, breaks in the piping, and it gets to your home. So the punchline is, no matter where your water is coming from, you really want to actually control what you drink, what your family drinks, what your pets drink at the point of use is when it hits your home. And so that's why filtration at your home is so critical. Or in my case, here I'm at work, it's in my kitchen of my office. And they're not big, but I prefer, you have all different choices. I talk about all of them in the book. I talk about all the different pros and cons, pitchers, distillers, carbon block, UV filters, all of that is in there. But what I like to land on is what I prefer, which is reverse osmosis, because it's by, it's the actual material, the pore size is so darn small that it literally catches the most things we can catch as consumers. We use reverse osmosis for dialysis patients, but a much more aggressive form of it. My dad's a nephrologist, and I just actually had a tour of a dialysis unit and how aggressive reverse osmosis is used in those environments. We're getting a decent portion of that aggressive cleaning when you buy a commercial RO filter. And I don't share brands, so don't ask. I wish I did. When the time is right, I might, but right now it's all academic, and I don't want to favor any brands for any reason. I want this information to be out there. And I teach people how to choose the brands. So everything I talk about, I teach people how to, the fishing rod. I give people the fishing rod because I want people to know how to do this, even if brands change, formulations change, companies get sold and bought, and believe it or not, things get changed from that perspective. So you want to go to the sources that actually watch these components and can tell you whether they get a new rating in terms of toxicity. So water is really quite important. We don't think about it enough, in my opinion. I think it's the most recognize, I think I put this pretty strong statement in the book, almost it's the most under-recognized contributor to human health issues that I can think of. Even beyond food, believe it or not, because of by volume. So it's something I really think people should consider strongly, even when you share with patients. Figure out what you like, figure out how you figured out your process, and then maybe if you're comfortable, you can share that with your patients. But I always say, experiment on your own choices first so that you can get real. I mean, I've tried every filter. I mean, people send me filters from companies and I try them out. I even test them pre and post with my own money from, a TAP score, third party testing kit, which aren't cheap, which aren't expensive. So I warn people against doing a lot of that. But the idea is that I want to give recommendations that I think are legit. And I think the way you do it is you practice on yourself first.
That's really such an important topic because we all drink water, and it's something that I think is now getting more education around, and that's really powerful. And we've talked a lot about, okay, we don't have control over the water that comes to our house or our apartment or our workplace every day. And we also don't have control over a lot of the toxins we're exposed to when we're out in the world. We talked a little bit about making better choices at home using a filter. I think something that would be really helpful for health coaches to understand more is to, as they invite their clients to be curious and want to reduce their own toxin exposure, two more points about it. What is it that we can control? Because I think it's really important to focus on, okay, there's a lot of these uncontrollables. What can I control? And
Sure.
secondly, with that and focusing on what I can control, what are the benefits to me and how will that impact my life? Because it's a lot about lifestyle. So can you explain a little bit more about that? What can we control to not just scare people, but bring optimism?
Yeah, well, I love the serenity prayer. I made it as part of my beginning of my last book, because serenity prayer really, I think, encompasses this topic. What did I use for this one? I used Socrates actually, for this book. What did I say? Oh, the secret of change is to focus all your energy not on fighting the old, but on building the new. So same idea. The idea, though, however, is that you want to take your energy, your money, your patient's money. If you want to make sure people are using all of this properly. Or I think high efficiency, right? You want it to be the best use of your dollars, time, and energy. And I think when you understand what you can and can't control, it's eye-opening how much more we have control over our health than we think. We have control over our home. We have control, maybe over our work. I have stories in the past where I went to my kids' daycare and I didn't like all the smell and the automatic sprays and the closed doors that they didn't open the windows, and then found out that the teachers didn't use cleaning products at the right concentrations. And I mean, that was a whole story that happened 15 years ago as well, at the same time as this dog thing. So, I think you have more of a voice than you think. And that got changed, by the way, pretty quickly. And I think it's just, the tone and the way in which it went about. But we have control in our home where we spend 93% of our time, we have control in our workplace where we spend another, whatever, 5%, 10%, if not more. Our car even has controllable aspects too, in terms of spraying stuff in the car and where we wash it and what we have cleaners. And, so there's stuff you can control at all different aspects. The question is, where's your energy best spent? I look at things as, kind of like efficiency, because I'm tired and I'm working hard for kids. Like, what are the highest yield things that I can do without worrying about the minutia as much? And I'll work my way through to the minutia. And water, food quality, organic foods, for instance, has so much value. I go into this whole chapter about food. Not saying you only have to get organic, because you can wash produce, you can wash, and I give recipes for these, simple washes, or, but thinking about USDA organic is one of the only regulations we have in our environmental system of the US is, the USDA organic food system, and criteria and mandatory regulations and what that means to chemicals and reduced pesticides, farming chemicals, genetically modified ingredients. But all we have to know and teach our clients is there's a USDA circle with the letters USDA on food that really holds them to a different standard than all non-organic. And by the way, I know someone's going to say, well, there's expensive or something like that. Let me get right out that. I have spent more time in supermarkets across this country than any human should ever have to. Trust me. And when you go to the frozen organic produce section,
Yeah.
every big box store knows how much money that brings in, and they've created their own lines. They don't even want other companies. And I can tell you that you can find so much great produce, fruits and vegetables that are organic in plastic bags, which you have to remove and heat up and blah, 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 and not steam plastic or reheat in plastic, as many of you know. But the idea that we have access, and here's the bonus of frozen USDA organic produce, it's highly nutritious. So that third piece of add, that third A, which is add, we need nutrition. We're deficient. We are literally deficient, not by just our choices, busy lifestyle, and consistency, but by our food system. Our food travels, it loses nutrient value. Frozen organics have so much nutritional value because you pick them. They're flash frozen. So they pick them, they freeze them, and they maintain a lot of their nutrient value. So really, it's a win-win. I mean, who knew, like growing up, that I would think frozen organics were ideal, but in this modern day food system, this is where we're at. And it just really shows us how our modern day lives shape our behaviors and our choices now.
That's so powerful and educating on, what can I focus on? What can I actionably take steps on instead of just fear mongering around
For
all the
sure.
problems? And this has been such a great discussion. I want to go a little bit into the Q&A portion now. First, I would love to hit some of the pre-submitted questions that our alumni program and students have submitted before the webinar, and then we will open it up to the Q&A toolbar. So if anyone has any questions that arise that have come up so far, please feel free to throw them in that Q&A chat at the bottom of your Zoom. But first of all, let's go into some of the pre-submitted questions. Can you address cellular detox, specifically including functional membrane health or vulnerability?
Yeah, so that's a great question. And so if we want to get into the weeds of this, so at the cellular level, we have a lot of interesting components to the human cell that act as surveillance mechanisms. They're called inflammasomes. And basically, I mean, this is just one component. There's so much to the immune system, but I'm trying to give something that actually has been well studied. So the inflammasome basically are little protein units that are used, basically, they're in the cytosol of cells and basically can read changes within the cell, including environmental exposures, believe it or not. And what it does is it kicks off a whole series of cascades that actually increase inflammatory response. ILB6, IL-17, a lot of feedback loops. I wish I had a picture of the cell, that was so interesting to look at, because you see all the organelles from, high school biology, but you see the cytosol, and within the cytosol, these microscopic inflammasomes are almost like a surveillance unit. So we know that at the cellular level, there's feedback. Then this great paper, I usually put slides up. Then there's this organ level component where the cells are feeding into the organ as a whole in terms of its function. And there's feedback in that. We have all these feedback loops in the human body, right? Because it's evolution. We're trying to survive. We're trying to give our bodies a chance to protect itself and conserve energy over evolution. Anyway, so you have the cellular component speaking to the whole, organ units. And then you have, of course, organ to organ components and feedback loops. We see this with, cortisol. We see this with all the hormones. Well, it turns out a lot of these chemicals, one of the key things that was discovered about BPA originally, which is being, I'll get into the politics of that. What was discovered with BPA years ago by Fred von Saal and colleagues is that many of these chemicals, and they discovered this by accident, by the way, because of a plastic water feeder for mice was giving poor results, and they had to trace it back to the plastic water feeder for the mice they were studying. It turns out that they act as low-level hormones. So especially estrogens, that was the first component of these endocrine disrupting chemicals, or EDCs, that I've written about, that everyone's been writing about. EDCs are endocrine disrupting chemicals because they were found to disrupt the normal physiology and messaging of hormones, which have been conserved through millions of years of evolution to be very, very small amounts that do really big physiologic things like growth and development and brain development and bone strength and fertility and digestion and insulin management, all of our hormones. So very, 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 very small amounts can do this. Parts per million, parts per billion, parts per trillion. And so that logic goes against normal toxicologic logic. So Paracelsus in the 1500s discovered, the dose makes the poison, where there's like a linear, the more you're exposed, the more likely you're going to have that physiologic effect, right? The dose makes the poison, the dose gives you the effect. And it's very linear. It's just a line, right? We could say that from turning 21 and going out and drinking. Not that I ever drank, but the idea is that the more you drank, the more you got sick. Okay, as an example, right? So these endocrine disrupting chemicals were first discovered to be like not work the same way. They work almost like a U curve, not a linear curve, where at very, very, very low levels, they can have the same physiologic effect as very high exposures, high doses. And that threw toxicology on its rear. Like no one could believe it. And as this EDC research world start to evolve across, continents, and now there's a huge, amount of research and worldwide, agreement on this. And then the number of chemicals that fell within this, kind of category of endocrine disrupting chemicals, it really threw toxicologists off their head. And now politically, what that means is that many companies don't want to look at the lowest levels of exposure because it makes their brand, their chemicals, their product look really bad. Because they want to believe that the most exposure is going to cause the most problems. So let's just keep to this level. But what we're discovering, or what I should say the researchers discovered, is even below that threshold is where you started to see even physiologic problems that were very harmful. Okay. So there's a big battle, not that, you need to know all the politics, but there's a big battle between a lot of the toxicology world from big ag and big pharma and the people who have discovered the way these chemicals work. Okay. I hope I didn't confuse anyone. But needless to say, that's how a lot of these chemicals work. It's such tiny levels. They affect receptor numbers. They can upregulate, downregulate. That's why they're disruptors. Immune disrupting chemicals, as I call them, are similar to endocrine disrupting chemicals because there's lots of ways to disrupt. It's not just one mechanism. For autoimmune diseases, in the case of what I describe in the book, an autoimmune disease that I treat, the idea is that there's several different mechanisms, but one that stands out is called molecular mimicry, where our immune system actually looks at these chemicals and triggers a self-response, a response to self-antigens, which is its own body, right? Ourselves. And so it's basically mimicking, molecular mimicry, what our bodies are seeing synthetically, and it's confusing our immune system into attacking our own body, thinking they're similar. So that's how this concept of how we have an increase in autoimmune diseases is that our immune system's off. There's also gut microbiome effects, not just on the mucus layer of the microbiome when we're dumping in processed foods and dirty drinking water, but we also have direct effects directly knocking off the microbes, right? Pesticides, things that change the microbiome directly. So there's so many mechanisms. I do bring them up, not heavily, but the idea is that there's just, it's a big topic. The punchline is, let's reduce those chemicals so we don't have to figure out why they hurt us. We just don't need them. We have so many other ways to go about living our lives without these toxic chemicals. Let's know where they are and let's, try to remove them, in a reasonable way.
Well, great. You touched a little bit on this next question with what you were just discussing with autoimmune, microbiome, but aside from infertility, what specific effects are being seen in people from the toxins that we are exposed to in our plastics, cookware, everyday toiletries, EMF, etc.? Is there anything to add?
Yeah, no. So again, I don't want to sound too trite and cliche and kind of obtuse. I want to say that there's definitely science that supports certain mechanisms versus others. So all chemicals do not fall into the same necessarily category of harm. Because like, say, for instance, the perfluoroalkyls have been discovered, these are the forever chemicals, the ones that are on Teflon, Gore-Tex, non-stick, rainproof, stuff like that. Those have been associated with things like kidney cancer has stood out to exposures at high levels. And we know this from Dark Waters, the movie Dark Waters. That was about, if you want to see a good movie about PFAS and perfluoroalkyls, that's a true story. Robert Billet was the lawyer, and he followed this out, and it was a town exposed to these chemicals from the manufacturing. And so they discovered, and they were like sort of guinea pigs, unfortunately, because they got such high exposures through their drinking water and all that. But they were found to have higher levels of kidney cancer. Specifically, they were found to have lower response to vaccines. So it dumbed down their immune system, their innate immune system response to create antibodies. And so they had a reduction in vaccine response, which is worrisome because we're all kind of loaded with a lot of these PFAS chemicals, and yet we want to be immune to certain problems, right? If you are going to move forward with vaccines, which, we've had a lot of drama over that. But the idea is that we need to know how our immune systems work in the face of being exposed to many of these chemicals, and try to reduce the chemicals so we don't let our immune system go off the rails, and we can harness it the way we want to harness it, which is, again, the tool book for this book is understanding the big picture here. I forgot the rest of the question, or did I answer the question?
Yeah, it was just what specific effects are being seen in people.
Oh, yeah. And yet there's also soft signs. Like I talk about fatigue. I have patients who come in with rheumatoid that have real swollen joints. Medications are great. Don't get me wrong. I use them all. I mean, you can't be a rheumatologist and not use these tools. But we also have so many tools to reduce inflammation that are chemical based, that when people change their diet, change their cosmetics, change, exercise, sweat out chemicals, sleep more, there's a remarkable response to the human body, which makes people feel
Lifestyle components that health coaches really focus on. So that's really
absolutely. This is a piece of the whole puzzle. Medications are not, a problem. They're just another tool if you need them, just not to use them reflexively, which is what I've always been taught, because medicines are chemicals too. But you have to always weigh out risk benefit. And I think that's just a judicious way to go through decision making with your clientele.
cool. So one thing we didn't touch on, the next question asks, are our clothing materials really that big of a concern?
Yeah. So, look, I worked out this morning, and I'm sure there was a headline on, Lululemon and PFAS or something. Here's the thing. I think it's definitely something you can think about if you're choosing to buy another pair of clothing, another set of workout clothes. I think dermal exposure is essentially what we're talking about. You're not eating your workout clothes, I hope. The idea is like, what is by volume most likely to get into your body? And certainly when you're sweating, there's an in and out of your sweat glands, not just, out. But I really want people to say, you know what? I wouldn't spend all my energy worrying about which workout clothes if I'm going to the gym and go using their showers and putting all this stuff that's stuck to the wall, shower, body wash, that I don't know what's in there, or if I'm thinking about not worrying about my water, or if I'm getting my nails done and I didn't really think about the base coat, which touches my skin, or if I'm eating a lot of processed foods. You just have to decide what means something to you or to your clients. You need to figure out what hits you here, because that's where you're going to end up starting, hopefully first. And so I think that if it matters, choose it, figure it out. And it's not hard, but I tend to downplay a little bit of the derm stuff as compared to, say, the vaginal route, feminine care products. People don't realize that is really absorptive. We should change out those products, especially in young women, for sure. And thinking about what we drink and what we eat, even what we're breathing, because it's such like a low hanging fruit to be able to clean out your air quality in a better way.
Well, so all of these questions relate to each other in some way. But next up, what everyday lifestyle habits, diets, or supplements should be incorporated for recurring detoxifications from these toxins?
So a lot of these chemicals, we either know the half-life and how fast they break down. Some are longer, like the forever chemicals. Some are short, like BPA. So if you change out canned foods, for instance, some really nice studies I talk about in the book, where you change out certain lifestyle choices, product choices, we have studies to support that they lower the amounts in your body. So, thinking about that, lifestyle choices are just as important in terms of what you choose, even the food packaging you choose. But when it comes to the human body and anthropology and evolution, which I've come back to a lot, I really think about, well, what are we capable of? We have skin that sweats. We can use saunas if we're, for rheumatology patients, they don't always can run a marathon. So sauna, chair exercises, um, you know, what else? Sleeping is such an undervalued component of the immune system, and getting not just quantity, but quality sleep, because all of that matters towards reducing exposures that we encounter during the day. Managing stress is so critical. And then again, what foods are medicine? Foods can be medicine. Cruciferous vegetables. I list a whole bunch of stuff in the book that anyone can incorporate. And I even have 25 recipes that are so easy and basic. So the idea is that we have lots of options for not just what we take out of our exposure, of our lifestyle and our bodies, but what we put in. And that combination is really where you get the most response in terms of feeling good and actually reducing health risks.
Next up is, what is the best way to detoxify petrochemicals and heavy metals if someone does not detoxify well? So you talked about some of the detoxification methods, but what if they don't detoxify very well?
Yeah. And so here's the nuances of where we're moving into personalized medicine in MTHFR genes and looking at cytokine P450s. And so I kind of understand the question. So, if you're going to do that testing, which I think a lot of people opt to do, I don't, even as a rheumatologist, because I look at everyone for every single exposure as being variable. We're all variable. We're all mutts. We're all come from different genetic lines. We all have different exposures, childhood trauma, you name it. We're all individual. So what I think about when I talk about in the book is I talk about doing all this for every human. Reducing exposures from heavy metals is a real thing, right? Even I put ICD-10 codes in here for people to utilize their insurance to test from LabCorp and Quest. You don't even have to spend a lot of money to do outside testing, right? You don't want to have people spend money where they don't need to if they're already paying into insurance. I think about that. So you can get heavy metal testing. And the first thing you do is not to run to chelation. It's not to run to expensive testing or expensive procedures. It's really behavioral. I can't tell you how many people lowered their arsenic levels, their heavy metal levels, just by changing up their diet, changing their water quality. It was just so much easier and reasonable than to have people go through a fortune of more testing, more chelation. It can go nuts. And I mean, look, if you have integrity, you're not going to want to be thinking about robbing your patients blind when you can, right? Desperation, a lot of people are taken advantage of in the wellness world, just as much as in the Western world, if you want to think about it. So it's all about having integrity, letting people really have cost-effective options if you want them. And I put them in the book so that people can use them, and just hand doctors, hand healthcare practitioners their ICD-10 codes with what I recommended is very basic screenings. Yeah, I mean, I think that's kind of where we're at. Everyone's going to have different processes of reducing or breaking down chemicals for sure, and some more than others for sure. But I think doing some of these testing, like genetic testing, it scares patients. It keeps them away from probably some good stuff as well as, bad stuff. And I think ultimately the message is the cleaner, the better. Even supplements that I talk about in the book that I consider the 4 fertilizer supplements, and why we need these 4. It could be more, but these 4 and why they work so well and what they do and how to manage them and how to choose products that have methylfolate or active forms instead of the inactive forms. These are all messages that everyone can employ, not just people who were tested once and told that they have a methylation problem or detox process problem, in my opinion.
It's so powerful that you talked a lot about the lifestyle factors, because health coaches, we don't prescribe supplements, but we can help in the lifestyle area. And that's what makes it so powerful, because those are what really, move the lever. So that is all the questions that we had pre-submitted. So I will move over to the Q&A toolbar right now. The first question we have is, why is it that within the same household, some members react to chemicals more than others?
Because we're all different, and everyone in the household is either a product of 2 parents with different genes, or the product of grandparents with different genes. So look, I'll give an example. I don't love this example, but it's true. In my town in New Jersey, all the farmers, it's a very old farming town. All the farmers, like, not all, there's not that many, but there's a few, they're all in their like 70s and 80s, right? 90s. And I said to them, you guys are using all these toxic, and I'm bringing them organic beers and asking them not to spray our backyard and, like, really trying to create nice, warm relationships and educate them along the way. And they've been really receptive, but they're all like, in their 70s, 80s, 90s. And I said, one of them said to me, well, we're living to long ages. We're not sick. And I said, well, you're on your third wife and the other three died, or two, like everyone is receptive of, these exposures in a different way. We're all, reactive or not. And that's because our genes make up a component, but our lifestyle plays a key role. I mean, and by the way, one of the farmers that I was working with just came down with Parkinson's, which is actually really sad to hear because he was very resistant to hearing about what I had to say about Parkinson's. And then all of a sudden, it's not like I want to told you so, but I think we have to keep working to educate people and having a ripple effect. But the idea is that, again, three things make up, in my opinion, whether or not you develop disease of any kind as a human being: your genetics, your lifestyle, and your exposures. And when I mean exposures, I also mean nutrition as well as toxins. So the idea that we can control all three of those, and I make the case for that in the book with evidence-based studies, I think people should know that they have more control than they think they do. And I think that's what starts the positive cycle.
Great. Next up is checking the homocysteine in the blood, a good way to check overall toxicity rather than having to do a heavy metal mold and many more tests that could be overwhelming and expensive.
Yeah, I think if the question is correct, I mean, look, people come here, and ask in podcasts for mold. You could talk about there's so many exposures that could potentially make you sick, right? So even with mold, you're going to be thinking about, an air purifier that aren't expensive if you think so, looking under boards, getting the right remediator. You're going to be thinking, if you had water damage, do you recall water damage? Does it smell like mold? I mean, there's lots of different things to go through that line of thinking, but it doesn't always have to. It could be like the 10 candles from, the candle shops that you have sitting around too, that could be just as an exposure issue and not think about it because that smells pretty. So I think we just need to do sort of an exposure questionnaire, very simple, and then where you can kind of chop things down. But again, the list of what people might have is very expansive. So when I do in my practice is I'll do the 50, close to the 50 questions. I move pretty fast, but also I'm asking about nutrition and where they spend their time and where they get their drinking water. And do they filter? Do they appreciate organics or not really know much about it? Or nothing judgmental. And then I think once I get that information and figure out where they're coming from, what they value, what they're willing to consider changing, that's so much better for diagnosis for me. Because it's detective work. We're doing detective work. When you have a symptom of fatigue, as I talk about in the book, someone coming to me, you're thinking about not just restless leg, you're thinking about all the things that cause fatigue. And I think that it's detective work, but you want to have the right questions. And I think it really helps narrow down what testing you actually employ that could actually be worth doing.
Great. This is important. What do you recommend on reducing stress for clients who have toxic overload that has affected them neurologically?
Well, that's a big question for all humanity, right? We're in it. We're in it right now. All humans, look, I hate to be like a broken record, but the more we pull away from social media, the more we pull away from the news that we can't control. I mean, we want to be informed citizens, but we can't be absorbing this world around us, especially if you're a caretaker or you're a practitioner in the healthcare world. We absorb, if you're a good person and you're a good practitioner, you will absorb the pain and energy from your clientele. And it's almost like it's great to be, sociopath. Because if you're a sociopath, you don't care about anything, you do great in business, like nothing bothers you, you don't have to apologize for anything. But if you're a good person and you're doing this work, in my opinion, you absorb the most pain from other people, even if it's very subconscious. So I really want people to take care of themselves, but find what gives you joy and do it. Like I have to run in the morning. If I don't run in the morning, I don't feel good the rest of the day. My choices are poor. I eat more carbs, more junk, if you want to call it, whatever. But I'm just not on top of it. And that's something that I've chosen to prioritize. I don't even start my day until, I'll have less patience if I need to run. So I think just figure out what gives you joy and really move towards it. Because if you're really good at what you do, which I'm sure you are, if you're even listening to this and care, you've got to protect yourself. You've got to put yourself first, and then you can help everyone around you, in my opinion.
It's very individual for what reduces each person's stress. I just went for a run this morning, and that's great for me too. So I think it depends on the person. Great. Very well put. Next up, what would you advise as far as detoxification that can positively influence women's fertility?
Oof, I love this. My colleague Victoria Mazes wrote a book called Fruitful. I thought it was excellent. It's about 7 years old now. I took a lot of her information with a hat tip to her work to stuff that I talk about, and even in the last couple of books. And the idea is that, it's a lot of the same material that I'm sharing. Essentially, that these chemicals can affect hormones. By the way, every immune system cell in the human body is estrogen receptors. So this interplay, this communication and crosstalk between the immune system, as I'm framing it through my book, endocrine system, I've done through other books and people have heard before. The idea is that this interconnection is important, and fertility is so anthropologic. Our bodies respond to very low level signals. That's how we develop growth and development and brain health and dimorphism and sex organs, sexual brain development. All of that is in an environment that's so critical. So when I think about fertility, I really think about the 21-day plan. I really think about cleaning out your body, making room for cleaner products to get your body ready for this incredible process of childbearing. And so, yeah, I feel like every OB-GYN in the world should be embracing this because they see people before they want to get pregnant even. So there's such a catch there to check people and educate them in ways that prepares them to manage a pregnancy when these chemicals are absolutely crossing the placenta and can be found in cord blood. So, I think in terms of fertility, stress plays a role, nutrition plays a role, body fat, plays a role. Our bodies have to have enough fat and enough healthy fat really to carry a child. So you don't want to be underweight, lots of issues there. And so it's just a matter of being balanced and reasonable is really what I've seen in terms of fertility, in terms of, helping to that process along.
Yeah, we just have a few minutes. I want to get through as many of these as we can. But along the same lines of feminine care, we have a question. You mentioned vaginal care. I guess that applies to tampons. Are there any healthier options out there, or should we all use pads?
Great question. Well, pads can have chemicals too. So I want to make sure people look at, and here's a good point to make about personal care products is that even if they say organic or have an organic ingredient, it doesn't mean the rest of the chemicals aren't toxic. Only food industry protects organic through and through. Okay. So yes, it's great to have marketed green labeled products, but you have to really be careful of knowing the company, knowing what they use. Do they use rayon or cotton, polyester versus cotton tampons? Do they add bleach? Do they add antimicrobial chemicals? We don't need antimicrobial chemicals in the vaginal canal. It's a self-cleaning machine. So the idea that we choose our products very carefully so we don't disrupt a healthy microbiome is really important. You could say the same for condoms because there's lots of chemicals in condoms. But here's the thing. The vaginal canal was designed to be absorptive. We take advantage of that as physicians. We use estradiol creams and douches and all sorts of stuff. And we know that the blood level immediately shows that because it's just so absorptive. In fact, the tissue of the vaginal canal, this may be gross, but I'm going to say it anyway. The tissue of the vaginal canal is absolutely the same as the GI tract and even the mouth interior. So They even, when they do lip transplants, I think I saw this when I was like 15 or 12 years old, couldn't believe it. They use vaginal tissue to create someone's lips because of the color, because of the absorption, because of the tenacity of it. So the idea is that we got to be careful about how absorptive that skin is versus our skin, which has an epidermis and a dermis and all these different hardcore layers that sort of prevent too much dermal absorption. So it's just one of those things where if you could find a couple good companies, look, I think big box stores like Whole Foods and whatever, I don't work for them, but they have really smart people working there and they can be helpful. I think looking up and doing your own due diligence, reading about the company, reading about what their third party testing is about, because that's what I recommend, is do a little education on your own. But keeping in mind that there's lots of things that are put into pads, douches, feminine care products that really shouldn't be there. And that, what you do, even a silicone cup, actually, silicone is the only plastic that I could arguably say, from what I understand and studied, is the least toxic of all plastics. We wouldn't change baby bottle nipples, really, because there's nothing that feels the same way that I've seen. But again, it has to be like medical grade silicone and not just junk from China, in my opinion.
Okay, great. Are you okay if we go over just a few minutes? I want to try to, and we won't touch all the questions, but I'll try to touch a few
Only
more.
if people buy a book. I'm only going to go over if they buy a book.
Well, one question is, what is the name of the book you have been referencing? We will send out a replay of the webinar, and we will include the information of the book in the email. But it is Detoxify.
And I will say that I'm particularly proud of Andrew Weil's testimonial, because he doesn't give them out, and he's a friend and colleague. And Fran Drescher's been on board. I'm on her medical board for Cancer Schmancer, which she's been a really incredible advocate for environmental health. Who knew? But she was really started this movement a lot before. I mean, actually, I wouldn't say before I even got involved. So, a lot of people doing this work, they don't always get the credit they deserve, but it's been a really remarkable village. And I think Terry Walls, people know about her from multiple sclerosis and all the work she's done. These are just, they're getting out there. I mean, we're all getting out there because it's become such an issue to be sick. And I think that the more we share the positive side of prevention, of management, I think that's the tide that lifts all ships.
Terry Walls is actually one of our educators at FMCA, so everyone knows her well here.
Right.
We'll include that info in the webinar replay. I'll go through this. One last question. What is your view on schools? It makes me sad that our children spend many hours daily there and they use cheap industrial cleaning products that are very toxic. This is a good one to talk about. I think a lot of parents are out there that have concerns.
Sure. Well, I just had this incredible experience, took, a year to work it out, but I just lectured to my 2 teenage boys and their 800 upper school colleagues and friends for the upper school assembly. Like a highlight of my whole career. I was more, I've taught classes for high school, and I do a lot of teaching in high school, but these are my kids in the audience. And, one of the things the message I was trying to teach them more than anything was about having agency over their body, because they're not going to leave knowing about BPA or phthalates, and they're not going to know about the minutia. They don't even have the attention span for it. Okay. But what you teach them is that there's some really basic failures in regulation, that these are the products you're ending up choosing, but you can choose better. And remember, your body is a sponge. And if I tell you, I put up a picture of a sponge and I told them that you have a right what you put in, on, and around your body. And then these are the key issues. And here's the thing, the schools won't necessarily change. I'm trying to change schools, school education, all that, but it's such a slow pace. Even healthcare doesn't change even fast enough. But what they do for their bodies at home, what they choose for food, how they get their water, what they carry their water in, and mind you, the EMF radiation, I told them, you guys have to stop putting your computer right on your lap, and you got to stop putting these phones next to your head. I said, here's why it matters. You're basically shoving your head in a microwave, okay? Because these are microwave waves. You don't want these in your pockets. My boys constantly, I said, I want to be a grandmother one day, okay? We know lower sperm count, lower sperm quality. It's all about distance. It's not taking away your phone. It's not taking away anything. It's really about how do you use the products, the cell, all the tech toys. How do you use them more intelligently, more safely, so that you don't encounter problems along your whole lifespan? I think that's the message we want to send for them, because they're going to go off to college. They're going to go off and have jobs and travel. It's more about the big picture message, I think. So, you do the best you can. You control your home, you control your work. You can't always control schools, summer camps, all of that, but you do the best you can. Arm these kids with the idea that it feels well. In graduation, like I'm actually thinking to myself, like this should really be a graduation gift. Like my older kids going to college. Like these are the things that I think the kids would want to know about as they're moving on in their lives. So I don't know.
Well, thank you so much, Dr. Aly. I know that we have run over a little bit. We didn't get to quite every question, but we will be sending out a replay with the replay of the webinar, and then we'll include the information about her new book. We'll also include some other detoxification resources. Listen to the podcast episode if you haven't gotten a chance yet. And thank you so much, everyone, for joining. Thank you, Dr. Aly. This has been so wonderful. I've learned so much. I know everyone else did too. And thank you.
Thank you for having me, everyone. And thanks for listening to my rant and yap. So I appreciate it. Have a great day and be healthy.